invite Dr. Jasbir Singh Kang. Dr. Kang is a medical director and in the Hospitalist Program. He works in emergency rooms, in hospital wards, and is very highly regarded, not only amongst his medical colleagues, but amongst the people in the Sikh community for bringing Sikhism into the American heritage and mainstream. Please welcome Dr. Kang.
Good morning. Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh. So, first of all, thanks for the invitation and kind introduction. What I do to de-stress myself, I'm going to share that first, and then I will talk about my journey. Can we play the video? Play the original one. So I will keep talking while they're trying to find the video. So we all have very different journeys where we started and where we are now. So I thought I should share this video before I start my presentation. So here we go.
The Punjabi American Heritage Society is a non-profit organization established in 1993 after a group of Punjabi locals in the Yuba City area came together to address the needs of their community. The society actively works with the community in creating friendships, educating locals about Punjabi Americans, and connecting younger generations with their roots. In 1994, the society kicked off their first event, Teacher Appreciation Night, where local teachers were brought together in hopes of promoting friendships and meeting the diverse needs of their community. This was only a stepping stone for the society. Since then, the society has actively played a big role in bridging relationships and understanding about Punjabi heritage. The annual festival, beginning in 1995, drew audiences from all over Northern California, where hundreds of kids have performed traditional Punjabi dances choreographed by society members. Several guests with exemplary valor and community work have been honored, including fallen soldiers, police officer Brian Murphy, and journalist Vishwamitra Tandon. 8 scholarships are awarded each year to local students annually. The festival promotes the best talent with the finest guest artists from all over the world. The Sikh Community Center, created in 2016, serves as a teaching ground for the youth. Over 150 children are taught how to read and write Punjabi, sing traditional Kirtan music, and participate in national speech competitions. Additionally, the society supports different camps centered on uplifting and empowering the Punjabi Sikh youth. The society is very active in preserving the participation of Punjabis in California's history for future generations to come. The Punjabi American Museum, a permanent exhibit at the Sutter County Memorial Museum, was curated in 2012 by members of the society in Yuba City. The society has also most recently partnered with UC Davis in creating a digital archive documenting Punjabi American pioneers. The society has created several outreach programs to connect and support members within their greater community. Individual society members have fundraised over $100,000 for the Rideout Hospital Foundation and National Sikh Campaign, along with supporting several non-profit and social justice-centered organizations. Members have partnered with communities from different backgrounds and supported educational documentaries, including an Emmy-awarded film, Sikhs in America. The Society's purpose is to bring awareness and friendships amongst the local American people. The Society hopes to continue supporting their community within the Yuba City area. The Society is incredibly thankful for their community and hopes to inspire the future generations to come.
So, thank you. How many of you are here with medical background or have a family member in medicine? Quite significant. And how many of you been to Yuba City? Many of those. Great. So, you know, we are all shaped by many things around us. Our customs, our belief, our parents, our environment. You know, we just heard Javant how the things affected her journey. So let me go back. You know, we call it a flashback technique. We're going from now to back. My parents were born in Lalpur, which is now called Faisalabad, which is in West Punjab, now in Pakistan. And my father's uncle, his chachaji, was the first in our family to go to school. He became a doctor in 1923, the first graduating batch from Glency Medical School, Amritsar, which became, now it's called Government Medical College, Amritsar. So my dad was very close to, I just want to get close to you guys. So my dad was very close to his chacha, and he always kind of saw him as a mentor. What happened in 1947, you know, I think most of the grown-ups know that we were basically given 24 hours, 48 hours to pack up and leave. There were no cars and trucks at that time. My parents, they all literally walked from Lalpur to the East Punjab, which is now part of India. So it was 8 weeks journey. And during that journey, the whole family got separated. My dad's uncle was a doctor, and he thought, I'm a physician, you know, I'm supposed to serve mankind, and he probably didn't feel as a physician, you don't see any religious differences or anything, so he thought probably being a doctor, nobody's going to harm him. But all family, unfortunately, lost their life in 47, my dad's uncle. So my dad was in 11th grade when he came to India. He wanted to follow in footsteps of his chacha, but unfortunately, you are homeless, you have no money, so he couldn't pursue the dreams of being a medical doctor, but he did very well. He became a scientist and accomplished veterinarian. But he always wanted one of his sons to pursue medicine. So my older brother became a dentist, so the onus fell on me to be a doctor. So, you know, I loved my dad. He was a very loving and a generous man. So I thought I will go to medical school, get a medical degree, but I'm not going to practice medicine because I always wanted to be IAS. I even did even pass the theory, but that was early 1980s. And Punjab was in turmoil. 1984 happened. It totally changed my perspective working as a bureaucrat for a government where Sikhs were in big, I will say at that time, things were not very good for us at that time. So I decided that I need to go somewhere else where I can pursue my dreams. You know, as a kid, I always was inspired by President John F. Kennedy and Abraham Lincoln. So I thought America is probably the best place. So the good things happened. My wife, my lovely wife, Sukhjeet, was visiting in early part of 1986. We met, I got married. For me, green card was very easy because her family was already in US since 1950s. So now I'm here. So either I have to drive a taxi or do something, or I should put my degree to the use. So this is a place. I came to Stanford Library, studied for my exams. I was very fortunate, did well, passed my exams, got into residency very quickly. And after I finished my residency at Cook County in Chicago, still trying to like to practice medicine. Still in that phase, I mean, although my perspective started changing, because my dad always told medicine is a noble profession, but my heart was somewhere else. So it was more like arranged marriage, you know. Was still trying to adjust to the marriage. So, but I had a mentor at Cook County. His name was Avery Hart. He was probably the most accomplished teacher at our school. So I got to train with him, and I was very scared that I'm a guy who never paid any attention to studying medicine in medical school. I was president of the student body at medical college. I was editor of the magazine. I was a captain of chess team, cycling team, represented university, got gold medal at national levels in India. So my heart was always in extracurricular activities, not in studying hard, but I studied enough to pass my exams, never failed exam. So when I worked with Avery Hart, so there was a patient, came to our hospital, referred for a workup because we were a tertiary care facility. So they couldn't make a diagnosis on this patient. So I was intern, and my resident, who was trained in England, had already had a degree, MD from England, and very smart guy. So he gave a list of 20 possibilities on this lady. So my attending, Dr. Hart, asked me, what do you think, Jasbir? I only gave one. I said, she doesn't have a diarrhea, she has incontinence. He said, what do you mean? I said, maybe she has a diabetic neuropathy, you know. Anyhow, so I felt like, oh my God, maybe he's not gonna like me. But anyhow, make it short, after I finished my rotation, he called me. You know, we had a system of evaluating all the residents, and the residents will evaluate the intern, then intern will evaluate their teachers. So anyhow, he gave me 9 out of 9. He said, are you satisfied with this? So I was in a shock and total disbelief. He said, you're an honest guy, you didn't make up stories. So that gave me a kick that I could be a doctor. I mean, mentors make a difference. So he told me, go where are you needed. All my family was in Bay Area, and I went to Yuba City. And some of my family members were laughing at me, hey, what are you going to do that in that village? I said, well, my mentor told me, go where you are needed. So I started working at a county clinic there. I brought another Sikh physician there. There was a definite deficiency of physicians in our area at that time, and still a lot of parts of US are deficient. So they needed another doctor, a pediatrician. So we had a meeting, and they were discussing what we should do, because I was internist, I am internist, my partner is internist. There was nobody to see the kids in that clinic. So we said, hire a pediatrician. So there was a nurse there. She said, well, we already have 2 Hindu doctors. We don't want another Hindu doctor, because some of the patients want to have a choice. So this is how we were seen. I mean, Hinduism is a respectable religion, but it was used more in a different way, more like N-word, not like as a faith or whatever. So my friend started touching my shoe, and they said, you speak up. So I said, no, it's okay, bring a doctor, you know, people should have a choice. So our clinic administrator said, oh, this is a medical underprivileged clinic, beggars cannot be choosers. So that's where my Sikh spirit woke up. I said, no patient is a beggar. We are here to heal people, help people. Please bring a physician whosoever patient wants to see. So, you know, after the meeting, my friend said, Jasbir, you always speak up against injustice and things. Why you kept quiet? I said, no. There's no injustice. She's just simply ignorant. She doesn't know. It's our responsibility to educate her. He said, then what should we do? I said, next week is a Christmas. So we said, we're going to have a Christmas party for the whole staff. We're going to pay for food, drinks, music. So I went to the DJ, gave him $100. I said, after every 4 English songs, you're going to play 1 Punjabi song. So we had a great party. Lasted until 3 in the morning. So a few days later, all those same nurses coming and telling us, hey, never, ever we had this kind of fun party. You guys are great. Can you be my dad's doctor? Or can you be my brother's doctor? So within a few weeks, everybody forgot who we are. We were just one of them. So Then another experience I want to share. 3 in the morning, I get called from an ER. A physician calls me, Jasbir, I know you're not on call, but I know you just started your practice. I started my private practice in '95. That there's a lady, her doctor fired her. You know, you can fire your patient if you don't get along. You can divorce them, but you have to give a 30-day notice. So he said her doctor fired her, and she needs a doctor. Can you come and see her? I said, 3 in the morning? So, okay. So I got ready, go to ER. I said, good morning to the patient. She started looking at me like this. I said, good morning again. She said, I want a Christian doctor. And I said, what makes you think I'm not Christian? She said, you don't look like one. So how a Christian, I said, how a Christian should look like? She said, you tell me. I said, to me, Christian is a person who is compassionate, loving, and willing to person in their need, and I'm here to help you. She said, do you believe Jesus is Son of Lord? So the other ER doctor was an Afro-American doctor, and he's pushing me back. He said, yes, why are you taking all this? You know, he really used a bad word. He said, why are you taking that? I said, you stayed out of my business. Let me deal with her. I said, if by me believing he becomes the Son of Lord, oh, sure I do. She said, okay, you can be my doctor. So I took care of her, didn't show any emotion, didn't show any anger. So next morning, I go there to see her. And whole family is at her bedside. So I said, good morning. She said, good morning. So I go close to her. She had tears in her eyes. She gave me a hug. She said, I'm sorry. I hurt your feelings last night. I said, no, fine. It's okay. Carry on. You know, how you feel, what I can do for you. You know, within a week, the whole church started coming to my office. So that is a Sikh spirit. Don't walk away from a challenge. If somebody says you something, don't take it to your heart. They just don't know who you are. So the other thing I want to share, you know, some of the experiences. That's another really, which I think we all, especially I want young people to hear this. We had some doctors, Indian doctors there, they wanted to make their own association, a separate association, saying, oh, well, we want to fight the discrimination. They came to me, I said, I don't want to be part of that. I want to be the part of the mainstream organization. I don't want to isolate myself. Same thing was happening in India, you want to do same thing here? Let's be part of mainstream. I said, just do good work. Take care of your patients. Don't judge anybody. Do a great job. Just wait, good things going to happen. So in 2007, I got a call from Chief of Staff. His name was Dr. Stanley Nowinski. So I thought, maybe maybe I'm in trouble, right? Your Chief of Staff is calling you in your office, I want to see you. Say, well, come over anytime. So he comes to my office, said, I want to meet you in private. It scared me even more. So what did I do? So no. We have been thinking that we need a physician who can get along with everybody, who's credible and patient respect. We want to nominate you as the next Chief of Staff. I said, wow. So I said, let me talk to my wife. So I came home and I told my wife, my kids were young, and she said, well, you should do it. So I took the position. That helped me learn how the healthcare works in this country. I'm just talking to the physicians and our audience. You need to speak for yourself. Don't expect others to do things for you. Sometimes we always blaming, you know, we can say system is bad, this thing is bad. Let's be part of the system. Let's change the system. If you're going to let other people decide your future, they don't understand what you go through day-to-day life being a physician. So the other thing which Dr. Sahota mentioned, physician burnout is a real issue. Not just physician, in any profession, burnout is there. You have to look beyond your profession. So that's where this Punjabi American Heritage Society thing came into play. And I really want to thank Dr. Kapani, you inspired me to do that. So I talk to my friends. They say, look, we are all blessed. We are all professionals. We are all educated. It's our responsibility to help educate our fellow brothers and Americans and shed their ignorance. The only way to do it is by love. Not by being angry, not by being protesting. I mean, you have no idea that I have gone to churches, I have gone to any place they invite me to talk, anything to do with Sikhism. I will go there. I have even gone to very, very extreme right-wing places. But I tell you one thing, there's nothing more powerful than love. When they see you speaking from your heart and you have a love within you, you can connect. When you stop accepting others as equal, you are out of synchrony. So I basically give this example. You know, when we have Anand Karaj, we say that two souls become one. And people ask, how two can be one? It's not scientifically possible. I say, you sync your iPhone with other phones all the time. If you have the same software, you can sync with others. You know, to me, your love is the way to sync with others. So the other thing I want to share is that adapting to change. Change is inevitable. Life changes every day. Although you may not see getting gray every day, but if you take a picture every month, when you reach certain age, you can see changes happening. Even when you take pictures of flowers on the same day, you can see the change. Accept the change and use it to your advantage. I think I have a little time left. I want to cover a few moments, a few things that regrets in my life. Dr. Kapani wanted me to share. What are your regrets? Not spending enough time with my family, not taking good care of your own health while you're trying to take care of others. And what are my proud moments, which I already shared, giving back to the community, and few things I like to see. I want to challenge everybody in this room. When you walk out of this conference, make this pledge, what you're going to do to educate your neighbors, or in the schools, wherever you are, do one thing every day to educate somebody who you are. A few values which have helped me where I am in my life, which are Sikh values. Always believe that there is an Almighty, hard work, and sharing, not just with your family and friends. As she mentioned, Dr. Rangi mentioned, you know, she went and helped this taxi driver. That's real sharing. When you share without any personal gain. And seva will always reduce your stress. When you do something without personal gain, stress comes to you when you're trying to get something in back. When you're doing things without getting anything in back, there is no stress. We really need to work on improving our Sunday schools. They are the key to the future. And send a message of eating healthy diet. We are not eating healthy. And the last point is, which is amazing, very scientific. It's called Chaddi Kala, infinite optimism. Be in Chaddi Kala. Thank you.